Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and I will demonstrate how to test signs of meningeal irritation. And it is very important in two clinical situations. One, when you suspect meningitis. You know, meningitis is unfortunately common in our country. Bacterial meningitis, viral meningitis, tuberculous meningitis, or also in subarachnoid hemorrhage. That is another fairly common condition that can occur at any age. So both would have signs of meningeal irritation positive. You would need this to demonstrate that there is a problem in the meninges. So this is how to demonstrate, how to do these tests. First, very basic thing is to ask the patient to touch his chest with the chin. If he can do this without any discomfort, without any resistance, without any problem, I would be pretty sure that the signs of meningeal irritation are going to be negative. करके दिखाएं जरा, ये चेन अपनी यहाँ टच करें, छोड़ दें, फिर दोबारा करें, right. So he can do it without any difficulty. So I will proceed. First of all, I will test his neck movement side to side just to make sure that he does not have any cervical stiffness due to some other disease like cervical spondylosis or due to some generalized rigidity. So when I move, I have to ask the patient to keep relaxed and not make any movement. I have to do the movement, the examiner has to do the movement. आपने लेटे रहना है, ऐसे हिलाई, ठीक है. So I can do it without any resistance at all. So no resistance, and then I would proceed with the neck stiffness test. So with the two methods, one is you just put your hand on the shoulder. This is an indicator that patient is not asked to get up, because when he tries to get up, he will naturally make these muscles very stiff. So that would lead to a wrong judgment. You put your left hand under his head like this one and put your right hand here and ask the patient to relax and gently try to flex his neck. आपने बिल्कुल relax रहना, like this. So I can do it without facing any resistance at all. He up to this touching the chin. So this is positive. Another way of this is normal, not positive. Positive would mean if I'm unable to flex his neck or if I face too much resistance, more than normal. And the other way of doing the same test is that you hold his head with both hands and your arms resting on his shoulder like this, and you do it like this. Both are acceptable. The first one was actually, I think, more convenient for the examiner and also more comfortable for the patient. So with this was the one sign, neck stiffness. If this is negative, very unlikely that other signs of meningeal irritation would be positive, but you have to proceed if you are appearing in the examination. So or if you are specifically asked to do the kerning sign. This is the kerning sign. In a normal person, it is possible if you flex the leg at hip joint like this, right angle, and then in most young people at least, you are able to extend the leg all the way to 180 degree without any discomfort or pain or resistance. In some elderly people, some people with joint problem, you might not be able to do it all the way to this level, but at least to some extent. So this is how to do it. Flex at 90 degree, hold it from here. With other hand, extend the leg like this, and if you're able to do it like this without any pain, I would also be looking at patient's face if he's feeling any pain or resistance. He is not having any pain and I didn't feel any resistance, so this kerning sign is negative. Remember, in neurology you always have to do on both sides. So I would proceed, and this one is on the other side. Again, I don't feel any resistance at all. So this kerning sign is negative. Neck stiffness was negative, kerning signs are negative. He could flex his neck very comfortably. So signs of meningeal irritation are negative. two more signs which may be asked in the examination. They are positive only when the other signs, the one I demonstrated, they are positive. So I think additional, this is called Brudzinski signs, neck flexion and the leg flexion. And the neck flexion test is when I flex his neck, if patient reflexively flex his legs, that would mean that the meninges are irritated, and then that would constitute a positive neck flexion test. Brudzinski's neck flexion test would be positive if when I flex his neck, when he automatically then he flexes his legs. And the other thing is Brudzinski's leg flexion test. If I do the kerning on one side and other one should not move at all, see the other leg remain there. If the other leg flexes, that would constitute positive leg flexion test. So these tests are not usually done in clinical practice, but you should know them because you may be asked in the examination. So this is all about signs of meningeal irritation. Thank you.